but
Sounds
we're
good.
just going to go over some questions that that people have been asking the last few days when they knew that you were coming on. So the very first question, and I think the most important question, was asked by a young lady, and she wants to know, how are you doing, Ron?
Thank you for asking. I'm doing okay. I'm doing okay. You know, it's all the days blend into each other, but
They do.
we're all of the challenge is exceeded by all of the compassion and positivity you see out there. You know, in times of struggle, San Antonio always seems to pull together and rise above the challenge, and that's all the fuel I need to keep going. Erica
Yeah.
at home is just got the world on her shoulders, and she's managing to power through with Jonah, and so things are all right, all things considered. There's a lot of people
All things.
struggling out there, so I'm not complaining.
Yeah, and I hear that you did you go on a fast?
Yeah, last Friday I did. Yeah,
And was it a
it happened to
fundraiser?
be Good
Somebody said it was
Friday.
a great idea.
It was a Good Friday fast to bring attention to the San Antonio Food Bank,
Oh yeah.
and donate the food that you don't eat to the food bank. And it was quite successful. So my birthday was the next day, so we did one of the we followed that with the birthday, please consider a donation to the food bank. So all of that together, we've raised $60,000 for the San Antonio Food Bank, which is 500,000 pounds of food for people in need. So it was great.
That's amazing. And yeah, she said that was a great idea and thought that was awesome. So just wanted to check and see how that went. So
Yeah.
those are our
I've been
two.
eating since then.
Yeah. Good. All right. So those are our nice and light and fabulous questions. People just wanted to make sure you were okay.
Thank you.
Now let's get into the nitty gritty and some of the hard questions out there.
Yeah.
With this epidemic that we're having, and I know I'm not getting into main numbers because, like I said, every day at 6:00, Ron's there reporting on numbers and what we're looking at on a day-to-day basis. But a lot of folks want to know, when will it be over as far as getting back into work and our normal interviews again?
Yeah. Well, so we don't know exactly when it'll be over. But we have now new data. So we've been working on establishing local data models with the science community, the medical community, to use the data of infections that they're seeing in San Antonio and trying to project out how long this will last and when will the peak of this infection be. And they're starting to get more clarity on it. And it looks like the models are starting to converge on a period beginning next week to roughly mid-May. So sometime in between that period of time, we're going to see the peak of this infection wave. Now, the important thing is, just because we're through the peak doesn't mean there aren't more infections that are occurring in the community. So what I've done with Judge Wolf is we put together a health transition team of medical experts to help us understand what are the conditions that need to be in our community for us to be able to open back up again, what kind of testing and isolation we need to be able to do in order for us to open up safely. Because what we're trying to avoid is when we open back up, more infections starting to create new outbreaks, in which point we would have to shut down again, and it would be even more painful than it is now. So they're working on that. The answers to those questions right now, but in terms of when do you think we're going to start easing back into normal life? I think the peak of this infection will likely occur sometime within the next 3 weeks, and then we'll start slowly venturing out into life again, and we'll establish some rules of the road to do that safely.
And I'm thinking that too, because I know, someone had asked, do you kind of believe in that same verbiage that the president's using and stuff, where we need to, like, we're all just going to immediately go back to work? I know the light switch isn't going to just turn on. It's going to be phases, correct?
I think so. And it's going to be careful, and it's going to be slow. And the point being is we've got to have our antennas up to be able to detect any new infections, because if we're not prepared to deal with the infections that do still occur, all of those that can just come very quickly mushroom, and then we're back in the same boat that we are now, and probably in a worse shape.
So speaking of that, I know we've heard like on the news that when we do reopen, like everyone would have to have masks on to even like come into the businesses and things like that. Is that something we're definitely looking at as far as when we do our slow opening?
So that's one of the essential questions that the medical folks are being asked. What does the opening up look like? What protocols do we need to have in place? So masks are now, as of Monday, going to be mandatory for everyone, in the public who's not able to, abide by social distancing. We got to wear cloth masks because that helps someone who may be sick and not know it keep from infecting other people. So masks are going to be the mandatory masks is in place by Monday, and that's one thing that we're going to be able to do to help us, slow the spread now. But also, it will likely be some element of mask wearing as we get out.
As we get out of there. Okay, so that opens up the question of kind of sort of the same issues we were having when we were trying to close down. But we have a lot of, I hate to even say it, the barber shops, the beauty salons, the nail shops, the people that really could go mobile, but are still like on that itch. And I think it's because everybody needs their hair done, Mayor. I really do. I just.
I'm about to get a razor out myself. So.
No.
So the second element of the public health conversation, which is happening within the next week, is the judge and I will be putting together an economic transition team that will begin to look at the health conditions that need to be met and figure out how they can be implemented by different businesses like hairdressers and theaters and grocery stores, how they will take that medical guidance and establish new rules of operations so that we can begin to open back up safely. But that's a great example of, say I'm a salon owner or I'm a barber. How do I begin to operate again under the new reality where we know there's infections out there? We're trying to limit the spread, but we also want to start working again. Those are the kinds of new practices we're going to have to put in place. But the first step for that is to get the medical guidance, and then we can begin to move that into the operational discussions of business.
Do you think that when we do reopen the businesses, that there'll be like a mandatory deep cleaning for businesses to do before they get back into operation?
I don't know. One of the first things that the medical professionals were telling us from the very start was clean all the hard surfaces, wipe them down with bleach or with, sanitizer. Make sure you're cleaning all the hard surfaces where, there's a lot of contact, or if somebody sneezes, it might end up there. So cleaning is always going to be part of the protocol. But in terms of a mandatory deep clean, like Blackman Mooring or something like that coming out to your business, I would have to hear that from the medical community as to when that would need to have happened.
Or maybe what type of business would be.
Yeah, if there's been a localized outbreak like what we've seen in the nursing home on the southeast side, one of our firehouses has had, we're hoping to have a small number of infections there, but nonetheless, we're treating it like a localized outbreak. Those kinds of places where we know the virus has been promulgated, those kinds of places will need a deep clean. But in terms of every business, I'd have to hear that from the medical professionals. I don't see that happening, but always cleaning surfaces and making sure you have sanitary practices in place is an important thing.
Okay. And you did mention something that just recently this past week has been going on with the nursing home over here on the east side, and the other one as well, which, there's lots of information that I think, people kind of have to hold on before jumping to conclusions and things of that sort of what's going on. Do you think, and then there's also, shall I also put that out there, there was a narrative that was out there this past week that the COVID was really big in the African-American community and things of that sort. I personally do not like that narrative. That's just me.
No,
do you think?
I think we need to talk about it. I think we need to talk about it. Here's the thing. Viruses don't discriminate. We've heard that before. But viruses are very damaging to the American health system, because the American health system is very inequitable. We have people all across this community, particularly in Texas, who don't have access to basic health care, in large part because some of the laws have been created, and things like the expansion of Medicaid have been rejected by some of our elected officials. That's part of the landscape, is that not everyone in our community has access to preventative health care. And that's especially critical and dangerous for a virus like this, which is highly contagious. And so what you're seeing, not only in San Antonio, but throughout the country, is that it's particularly happening in communities of color, in disadvantaged communities, places where there's a higher proportion of people without access to basic health care. And it's also preying on people who have underlying health conditions. And we know San Antonio has a high rate of chronic conditions like diabetes and heart disease. It's very dangerous for people with underlying health conditions. So when you have a health system that is inequitable, that doesn't reach everybody, coupled with a virus that is highly contagious and fatal, it's a bad mix. And so that's why you're seeing some of the rates higher in some places. San Antonio has been very proactive in understanding this and addressing it, which is why one of the things that you're seeing is we've got these health preventative teams for the last 3 weeks have been going out into communities where we know that the access to healthcare is lower, and making sure people have the information about precautions that they can take, where they can go get tested, where they can get tested for free, how we treat and identify infections, things like that, so we can make sure that we bring some equity to the handling of this disease. We have seen our numbers higher in communities of color, Asian Americans, African Americans, Hispanic Americans. All of these are higher. And so what we're trying to do is make sure that people have the information to get tested, to get treated. And we're starting to see those numbers now start to move closer to our population, which is good. That means we're making a difference in equity. Another thing that you're going to start to see is we're going to start having testing sites move around, so that we can, we're identifying or anticipating places where there's not enough testing taking place, and we're going to go and bring tests to those areas so we can get a better assessment.
Now, that bringing that up, someone actually asked a question. Now, where they get these numbers from, maybe they heard them on the news, who knows? But they said that there's 1,800 pending test results right now. What's going on with that? Is that a fact, or what are we looking at?
It was, and it's a source of frustration for every city in the country. So, or a lot of cities in the country. The federally contracted labs that were running these tests for the pre-approved drive-up sites, where we were getting the federal test kits sent to us, the federally contracted labs had a bottleneck of about 9 days in some cases to get test results back. And so while the people who had been tested were notified, none of the local authorities were being notified timely. So we had about 1,800 test results that were pending. Most of them negative, some of them positive. And our test results, you may have seen 2 days ago, jumped by 75 positives in 1 day.
Right.
A lot of that was attributed to the fact that we finally got a bunch of that testing back. So we knocked out about 66% of those. We finally got those back from the federal lab. Good news is we're starting to get them much faster. Part of the reason is we've gone and done our own contracting with a local lab called CPL. So we're getting those test results now within 48 hours.
Okay, good. Now, because remember when we first had the interview, and it was only a month ago, so it's amazing all the stuff that's happened in 4 weeks. But then it was not everyone was going to be tested. You know, it was kind of expensive. We were still the new first stages of it. Yeah. Now we're at the point where anybody can go get tested. Is that what we want? Do we want people? Is it going to cause a more baggage of test results? Like, what's the best, most logical thing there?
We want people who need a test to get a test. Anybody who needs a test to get a test. Here's part of the challenge. The tests that we have, and there is a shortage of tests throughout this country. We lost a month when, you know, when the federal government was not taking this seriously.
Anybody can go get tested.
Hold on, Mayor. I'm sorry.
Is that what we want? Do we want people? Is it going to cause?
Sorry, guys.
More back-end test results. Like, what's the best, most logical thing there?
I tried to start a watch party and it interrupted our actual interview. So my fault there.
That's okay. So let me answer a question about tests. There are not enough tests in this country. There haven't been. And every community in the country is fighting to get their hands on their tests. Part of the challenge is we want to get tests down here, but we also want to make sure they're validated and approved. We've had some communities go out and buy their own tests, and they're coming back and they have like accuracy ranges in the 60s, which is not good. That can complicate the issue. We also had the FBI confiscate tests in other communities that were bought that were not approved. So we're getting validated, approved tests. And we want everyone who needs a test to get tested. Right now, the tests that we have access to require symptoms to be accurate. So we really can't test asymptomatic people. So once someone presents symptoms, we want to get them tested. And we have tests available for that through the pre-approved site, through private labs, through the hospitals, through the Metro Health Department. So tests are available, but we ask people to get pre-screened to make sure that they have a symptom that's associated with the disease.
Yes.
And it's important to note that you don't have to have a doctor's order. You don't have to have insurance. You don't have to have a primary care physician. If you have symptoms and you get screened on our hotline number, you can go get tested and it won't cost you any money.
Now before, again, when we first started this, we did have to have a doctor's position,
right?
Because again, we were still unsure about stuff. So I just want to put that out there.
Yeah.
Go ahead, baby.
Yeah, that was part of the federal protocol. And when we got the test from the federal government, they established a protocol. So now that we're operating with our own labs, local labs, we can loosen up those restrictions.
Good. And I just want to make that clear because there's so much false information floating around, especially on social media, Ron. So, but it's not necessarily that it's false. It might have just changed.
Yes.
Because stuff is changing every week.
Which is why, we've done the daily updates on TV. I've been putting out a thread on Twitter every day, on Facebook and Twitter, to make sure that we have the latest information out to people, because the information, you're absolutely right, has changed as this has unfolded.
As it goes on. So now because we talked about businesses, Ron, it has been so hard to get any money help. And I think that sometimes we don't even really understand that you have small businesses. And a lot of times I might think of myself as a small business, but really small business is up to like 500 employees that can make anywhere from $1 million a month. So a lot of us are really mom and pops.
Right.
We're really even smaller than a small business. So when we went out there to get that help from the government and from all these different locations, it seems like we haven't gotten anything. Ruth Chris, I saw an article, they got like millions of dollars to help with their employees and stuff like that. And you're looking at this person that's a vendor or whatever a case may be. They're a solopreneur. They're not getting any help. Not that you have all the answers for that. Can you give us just anything, a prayer, an idea of what we can do? Because I know that's not something that you're just over, as far as distributing money to businesses and stuff. But what do we do?
So we're locking arms with the other cities in Texas and other cities in the country, and we are using our voices to speak for those small business entrepreneurs and folks who need relief. And we are pushing for legislation and stimulus relief from the federal government. We're also working with the state officials to get that money into the hands of small businesses as soon as possible through programs like the Paycheck Protection Plan, which now is fully subscribed, I was told. At the local level, we're also working with our working groups. One of them is the Business and Employment Working Group, which is focused on smaller micro business relief, to figure out ways that we can help. One of the things that we identified early on is, small businesses also have to pay rent. We've stopped evictions for tenants, we have made it clear that those evictions now have stopped for business tenants as well. And so just yesterday, the city council was talking about, some sorts of rent relief programs. We haven't quite gotten that far in terms of business tenants rent relief, but we'll be having discussions about ways that we can help small businesses. The dollars and the resources are largely coming from the federal government.
Okay. And I think that having a little security, knowing that just like your home, you can't get out, you can't get kicked out of your business right now, might keep people from doing some mobile businesses when it's still not safe to do it. Because I really think that that's what makes people nervous about completely not working and just staying home, because someone's still calling for rent. So knowing that idea, hopefully my businesses out there can relax a little bit longer and know that you don't have to rush and do mobile work, because that is what is keeping the spread going. You kept saying asymptomatic, which means you're not getting any symptoms, but you're still passing that disease on. So that's one thing that we're trying to stop. Question is, okay, we're talking about money help and you're talking about businesses. What about rent though? Because I will tell you that the San Antonio government website, I'll tell you what the complaint is. There's too much stuff to do. And I know that sounds crazy, but some of the paperwork and stuff they can't get to because their jobs are closed. So when you put in the information to get your rent help, it takes about a couple of weeks for them to get back, which is understood. Then you have to get a letter from your employee. I think your last few checks, it's a nice little amount of things that you need to get. Most of the people are worried about the letter from the employee because the employees aren't there. So they're calling and not getting any return message. So they're missing 1 to 2 documents and not getting any response. Is there a suggestion maybe that you can give to the people that are going through those issues?
I hadn't heard that before, but what would be helpful is if you or somebody can outline those challenges, and we can get them to our economic development department ASAP. The city council just yesterday we discussed the parameters of a $15.8 million rent and rental assistance COVID-19 emergency relief fund. It's focused on tenants, on residents, but we're also, like I said, working on the other aspects of the business relief. So if there's an administrative hurdle that we've created, I want to know about it so we can address that. So if you can send me something, that would be good, Neka.
I will definitely do that. All right, going on. We got a few more. Now these next couple questions, because we did answer about the salons. So just to touch base or recap a little bit, guys, when it comes to the salons reopening businesses, you're going to be talking with the health sector of all of this to really figure out when is the good time for us to slowly reopen business, and all the precautions that we need, from cleaning to masks to all of that good stuff. So everybody sit tight. We're not there yet, but it's coming, right?
Yeah.
We're working on money solutions, like you just said, working locally to try to figure out help with rent, business rent, things of that sort. So that is being done, people, here on the local level. So again, we got to the process has to kind of go. We have to have all these meetings. One thing, as far as the stay at home, enforcing the stay at home. Yeah. This is so hard because people know they need to stay at home. It's half of them feel like, oh, they're enforcing, but they're not really enforcing. So I can kind of break it. I mean, what do we do? What do we do?
Well, I have a very strong feeling that people are staying home because they know it's good for their health and they're saving lives, not because the government told them to. So when it comes to enforcement, we have enforcement provisions, and we have cited businesses who are just openly defying, and we have civil penalties, and we can even use law enforcement. But in terms of how do we get people to comply with these orders? it's really about making sure that they have the latest information about how this infection is working to really destroy people's lives. And it's costing a lot of lives and the health of our community. So I just got a signal that I'm being pulled into another meeting.
I know. I was like, I know you got that. Time to go. Y'all been talking too long. It happens. It happens, Rose. Okay, so I'm going to let you go. Tell the people real fast. You know, we do have our homeless, and I'm not going to say tell the people. I have someone that wanted to tell you, as far as the homeless situation is going, when you go to Haven for Hope and places like that, they want you to also talk to some of the homeless people there to get their opinions of how everything is running. Because when you talk about corporate versus people, you know, yeah, they're going to show you what everybody's going to show you what they feel like they need to be doing and what you need to see. But sometimes if you want to get down to the nitty gritty and some of the real issues, we got to go to the people that are staying there or using the facility. So they would just like for you to sometimes take the time, if you're ever out there again, to talk to some of the people that use the facility to see what they need and how they're doing.
I would love to do that. I was just before this started talking with a lot of folks that were in the, you know, that were using Corazon Ministries on Sunday mornings, and to get a sense of what are the challenges out there that are new that we're not anticipating. And but yeah, this is about serving people, and I want to be out there as much as I can.
Yeah, so that was it. So that I just want to give you that message. So you know, when you see those people, pull them aside and say, what do you think is going on, or what can I help you with?
And I see you and I hear you, and I want to see you and hear you too.
Yeah. So real quick before you go, dear Lord, thank you so very much for blessing us with this time. Please continue to watch over Mayor Ron Nirenberg, continue to keep him safe, continue to keep the resources coming, continue to keep the help coming, continue to just protect him and watch over him so he can continue to protect and watch over us. In Jesus' name I pray, amen. I don't get a chance to pray over you often, but that one I had to do because you're out there on the front line too, and we appreciate you. And if you need me, you know where to find me.
Bye, Neka. Thank you so much, y'all.
All right. Bye-bye. Go get to work.
Bye-bye.